Last year, it was unprecedented how little circulating influenza was detected. But surveillance throughout the year has continued, and for the last several weeks, influenza cases have been detected statewide. And for the last 3 weeks, it has been reported through New York State Department of Health that influenza activity is widespread. As of data from the first week in December, there have been an increase of about 90%, the number of cases that are reported. I think it's a reasonable concern because we know that both influenza and SARS-CoV-2 can cause severe viral pneumonia. And we know from prior influenza seasons that when influenza affects the lungs, it also increases the chance of somebody having a bacterial co-infection in the lungs. Main reasons being that influenza will change the immunology of your lung tissue and make it more likely to get infected by bacteria. And individuals who have a bacterial pneumonia on top of influenza are sicker. So we don't quite know yet what would be the type of severity of illness if someone has influenza and COVID. But since both of them cause severe lung infections, I think it's rational to make the assumption that there's the potential they could be worse together. I think the main public health concern is one, the strain it could cause on our healthcare system. So currently our healthcare systems are heavily strained because of challenges with staffing in nursing homes or staffing in the hospitals. So the capacity to take care of patients in both of these settings is limited. So if there is also heavily circulating influenza, will that also add to the number of patients who need to be hospitalized and then further stress already stressed healthcare systems? So that would be the major public health concern. We need to continue to promote these methods of prevention. I think there's a lot of fatigue around it. There's fatigue around masking and hand hygiene, but really now, as the influenza season is coming around, as well as the holiday season, we need to double down and make sure everyone does get vaccinated and try and prevent influenza and prevent COVID infections. We need to continue to do hand hygiene and respiratory hygiene to limit the potential for spread of infectious particles. And we need to continue to promote physical distancing so we can stop the transmission.